The City of New Orleans Health Department recognizes the importance of a portable lifelong health record and its role in disaster preparedness and recovery. After all, they understand exactly what the word crisis means. And while the word crisis may have a variety of meanings to different people, let me offer this one. When you can't get access to the critically important information and resources you need at a key time that you need them, that's a crisis. And when the unavailable information is medically related, that crisis can be very personal, even deadly. Right now, there's a weakness in the medical record system that we're all aware of. Medical records are kept primarily on paper and maintained in separate locations by various providers. They're vulnerable and generally not backed up where they can be retrieved if lost in a disaster or medical crisis. This situation was driven home, magnified, when Hurricane Katrina left its wake of destruction.
I myself was one of the nurses in the Superdome, and none of those patients had medications. Had we had access to medical records while we were in the Superdome, that would have been most beneficial to us.
I left so fast. I left my daughter's medication in the house, and she was taking 27 bottles of medicine at that time. I also brought her to a clinic that they had out there in Houma, and also a center, and they had a problem with finding what kind of medicine that she was on. And that scared me the most because she's a very fragile little girl and she needs her medicine, you know. I could have really needed a backup plan with that.
Before the storm, I had about 15,000 registered patients. All of our records were lost. All the information was underwater, and not only was it underwater, but it was underwater for over 3 weeks. So when we finally got back into the office to try to pull the paper records, they were wet, like wet tissue paper, and they disintegrated like wet tissue paper.
This lack of information created crises for countless numbers of high-risk patients after Katrina hit.
My arrival to Dallas led me to go to the reunion shelter where I sat next to a gentleman who had a kidney transplant. The medication that he reported to me just in conversation was an experimental drug. He did not know the vendor of that particular medication, so the primary care physician obviously had a huge challenge in front of her in terms of maintaining the health of the kidney that was transplanted into this particular gentleman.
As people came back into the clinic post-Katrina, there was no information that we could glean from them. They had no records that they could say they had come here or they had gone to any of our other clinics. So we had to start off fresh with a lot of them.
The Katrina disaster was certainly an extreme case of a medical crisis due to lack of information when and where it was needed. The situation magnified and spotlighted the weakness in the healthcare information system. It's vulnerable in the case of large-scale disasters of many types, not just hurricanes. But it can also cause a crisis on a smaller, more personal level. Take the example of an individual who suffers a heart attack while traveling. What information will emergency personnel have at hand to properly evaluate and treat that patient? A lack of quick and easy access to his medical records becomes a very real crisis for him. So what's the answer? A portable lifelong health record for each individual that's digitally archived for fast, convenient, and secure access under the control of the individual.
A personal health record is something that a patient not only has for him or herself, but it's something that the patient can actually take with him. The distinction between a personal health record and an electronic medical record is really significant. An electronic medical record is designed for the acquisition of very specific medical information in medical language that can be used by medical professionals. A personal health record is a digested version. The personal health record will allow the patient to be able to understand what is being written about him or her, but it will also be at a level of detail that for a healthcare visit, a healthcare event, a physician, any other kind of provider will be able to use that information in the critical decision making required for that particular health visit.
The availability of a patient's portable lifelong health record to those treating the medical needs of Katrina victims would have greatly facilitated their efforts.
If we had had the record stored off-site, it would have been much easier to regenerate patient records right after the storm and patient treatment plans right after the storm. Had I had access to a computerized file, I could have logged onto the internet wherever I was and found their information and been able to assist.
As a practicing physician, I will tell you that there is nothing more important than the history of a patient who I am involved in taking care of. Having that information have detail is absolutely critical. In an emergency situation, it can be life-saving.
The City of New Orleans Health Department is taking the post-Katrina medical experiences of its providers and citizens to heart. It's developing a plan to create portable digital lifelong health records for the citizens of New Orleans. This initiative grew out of the city's first post-Katrina Health Recovery Week.
Health Recovery Week in February of 2006 was an outdoor medical clinic where free health care was provided for 5,000 people. Support of that activity included many clinical organizations who brought medical volunteers to provide service. The technology piece was provided by Intel, including servers and technical expertise to develop the personal health records which patients were exposed to and which we found very happily they were interested in obtaining.
The patients who participated in the free clinics liked the idea of portable health records. Now, the City of New Orleans Health Department is one of the thought leaders and first municipal health departments pursuing a portable lifelong health records initiative. DOSIA, a coalition of large private employers funding development of a lifelong personal health record for their employees, dependents, and retirees, has stepped in to support the City of New Orleans Health Department's initiative. DOSIA has pledged to seek funding to provide its infrastructure to the City of New Orleans Health Department so that citizens there have access to an electronic lifelong personal health record.
DOSIA is a conglomerate of many employer groups that have come together to push the personal health information. DOSIA is a very ingenious application where you take tweezers and you pick out of your health information system the pertinent information to form a personal health record that is portable, accessible, and in complete control by the patient.
And the New Orleans Health Department is eager to be on the forefront of bringing the benefits of DOSIA to the citizens of New Orleans.
We're very excited about the opportunities which DOSIA brings to us, not only in terms of the portability of health information, but the capabilities of DOSIA to bring in data from many different sources to provide information for the patient and for those who care for the patient.
There's no doubt about it. The frontline providers of care in our communities must have the resources they need in times of crisis. It's time to move forward with a portable lifelong health record initiative, and DOSIA is an important first step.
It is our hope in the City of New Orleans that the personal health record solution be implemented within the next year so that patients will have the safety and security of knowing that their health information will be available to them at any location at any time, whether there is an emergency or not.
I think Katrina has taught us all we need to be prepared, especially with medical records and our personal records. So much was lost. It's unbelievable that everybody came in here and nobody had records.
What we are looking at is the combination of using DOSIA in the New Orleans Health Department to give citizens access to health information, because we are still in this hurricane alley. In the event another evacuation will come, which is fairly likely over the next 5 years, that people would this time have access to that personal health information no matter where they will go.